Hi everyone! Nijmegen Breakage syndrome is a hereditary condition mainly characterized by microcephaly at birth. The underlying gene, NBS1, is located on the human chromosome 8q21 and codes for a protein product called nibrin. Nibrin, or NBN, plays an important role in DNA damage response and DNA damage repair. Unfortunately, prognosis is usually poor due to the extremely high rate of malignancies.
NBS is a rare autosomal recessive disease. Identifying mutations in both alleles of the nibrin gene completes the diagnosis of NBS. Parents of the affected individual can each carry a copy of the gene, but don't necessarily show signs and symptoms of the condition. Worldwide prevalence of NBS is estimated to be 1 in every 100,000 live births. However, carrier frequencies can be as high as 1 in every 155 live births in Eastern European populations. As will be discussed further in the mutation section of our poster, the majority of NBS patients are identified with the homozygous 5 base pair deletion in the NBN gene with the founder effect observed in Caucasian European populations. Founder effect is the loss of genetic variation that occurs when a new population is established by a small number of individuals from a larger population. A 2021 study found a higher prevalence of NBS in the western parts of Ukraine and Belarus, especially in the regions bordering Poland, as illustrated on the map. The larger blue circles correspond to a higher number of patients diagnosed. They additionally observed a 46% frequency of malignancy in affected individuals in their study with mostly lymphoid tumors.
The function of the NBN gene is to produce the protein product nibrin, which forms a trimeric complex with MR11 and RAD50 genes, called the MRN complex. This complex is known to play a role in the repair of damaged DNA as well as the activation of cell cycle checkpoints. The most common hypomorphic mutation or partial loss of gene function mutation in the NBN gene that leads to the NBS disorder is a deletion mutation in which a 5 base pair deletion in exon 6 occurs, causing 2 truncated or shortened fragments of nibrin to be produced. The image depicts the exon structure of the NBN gene with various mutation sites in individuals with NBS. Additionally, unlike in the case of the usual phenotypes of NBS, it has been found that nonsense mutations of the NBN gene could also occur in a significantly less severe version of the disease, contributing solely to fertility disturbance. Furthermore, normally the identification of mutations in both alleles of the NBN gene contributes to the diagnosis of NBS.
Gene mapping and structure. Gene nibrin is located in 8q21.3. Its locus number is 602667. The protein is responsible for protein encoding, and NBN is encoded in 16 exons and spans approximately 51 kilobits of DNA. The gene encodes 2 transcripts of 4.6 kilobytes and 2.4 kilobytes that are expressed in all tissues examined and differ only in their site of polyadenylation. You can see figure 4 for the 3D structure of the nibrin stained green, and figure 3 from the NBS1 during nuclear localization after DNA damage and stayed with antibodies.
The most characteristic phenotype found in an individual with NBS includes age-progressive microcephaly, which is a smaller than usual head, dysmorphic facial features, mild growth retardation, mild to moderate intellectual disability, and in females, hypergonadotropic hypergonadism, which is a deficiency in sex hormones. Other possible symptoms include a combined cellular and humoral immunodeficiency with recurrent infections of the paranasal sinuses, a strong disposition to develop malignant tumors in the lymph nodes, and lastly, sensitivity to radiation.
NBS patients face great difficulty to be treated, and it is noted that they are also prone to developing cancer. While cancer patients have treatments that may be able to help beat it, the same treatments are not working for NBS patients. The treatment that is available, but not reliable, is a hematopoietic stem cell transplant. There has been controversy. The procedure have been no sign of it reducing malignancies. In figure 7, we can see the images of a patient that has granulomatomas, lesions from a patient with NBS. In the image A, we see results after a series of antibiotics and topical steroids. In image B, we see the results after the stem cell transplantation. As a patient, it is difficult to tackle NBS as there are no well-established procedures. There are ways to manage, such as vitamin E and folic acid supplements, chemotherapy for lymphoid malignancies, hormone replacement therapy for females, and gamma globulin replacement therapy. The gamma globulin replacement therapy is often utilized in NBS patients due to the IgG deficiency, IgG for immunoglobulins G, which lowers the immune response, leading to infection. However, researchers have not given up as scientists are working hard in order to develop the proper diagnosis to develop therapy and to treat NBS. For instance, there is a study being conducted as we speak. The study includes a treatment of low dose of treosulfan to individuals ages 3 months to 21 years old, followed by a stem cell infusion, which is a therapy utilized to repair damaged cells.
The flowchart in figure 6 on the poster shows the complexity of the process of diagnosing NBS through genetic testing. Since the most common mutation of the NBN gene is on exon 6, this is where diagnostic screening begins. After that, the rest of the exons are sequenced to look for mutations. There are so many mutations to the gene that could cause NBS, so covering all of the possible causative bases may take a while. If the mutation is still not identified, Western blotting and immunoblotting techniques are used to see if a possible mutation is expressed on the Nibrin protein. If no change is found, the search continues. If a difference in protein structure is found, the patient is diagnosed with NBS. Because of the complicated process of diagnosing NBS, the most common way it is diagnosed in reality is through differential diagnosis, as it shares symptoms with other genetic disorders. In this technique, a doctor rules out all other genetic disorders with less complicated mutations until NBS is the only one that hasn't been ruled out. Below the flowchart are our references. Thank you for listening to our presentation.